Zang, The Organ Systems of Traditional Chinese Medicine by Jeremy Ross. Chapter 9 Gan and Dan, Liver and Gallbladder. Gan functions. Number 1. Rules free flowing of qi. Number 2. Stored share. Number 3. Rules the tendons. Number 4. Opens into the eyes, manifest in the nails. Rules free flowing of qi. This is the most important Gan function. Failure of these functions forms the basis of Gan pathology and is associated with many of the characteristic signs of Gan disharmony. In simple terms, P rules the formation and hence the quantity of postnatal qi. Fei and Xin govern the movement of qi throughout the body, and Gan rules the evenness of that movement. Gan does not rule the volume or the force of movement of qi, and is not primarily associated with patterns of qi deficiency. Gan rules the evenness of qi flow, the smooth, unobstructed movement of the substances throughout the body, and hence the harmony and the regularity of body functions and of behavior. Gan disharmony results in obstruction, blockage, and stagnation in the flow of qi and substances, and in uneven, irregular, and disharmonious function and behavior. There are 4 main facets of the free-flowing function of Gan. Harmony of emotions, harmony of digestion, secretion of bile, harmony of menstruation. Harmony of emotions. Gan governs not only the smooth functioning of the body, but also the harmonious interaction of the individual with the external environment. If the movement of qi and the flow of the emotions is uneven or obstructed, the individual may give inadequate, excessive, or inappropriate reactions to environmental stimuli, resulting in disharmonious behavior and in disharmony between individual and environment. This involves the common association of the intellectual faculties of planning and decision-making with Gan and Dan respectively. Harmony of digestion. The Gan function of free flowing of qi is necessary for the activity of Pi and Wei in digestion. Also, if Gan is disharmonious, stagnant Gan Qi may overflow horizontally into Pi and Wei. This is called Gan invading Pi and Wei, and results in various digestive disturbances. Secretion of bile. The Gan function of free flowing of qi is also involved in the even harmonious secretion of bile. If there is disharmony of this Gan function, secretion of bile is disturbed. Harmony of menstruation. The free-flowing function of Gan is also important in menstruation, where there must be even, unobstructed flow of qi and share. This is related to the second function of Gan, storage of share. Stores share. Gan stores share and regulates the quantity of share in circulation at any given time. When the body is active, share moves out of Gan into circulation, and when the body is at rest, share returns to Gan. Disharmony of this Gan function may result in too little or too much share in circulation, or in irregular functions in the volume of circulating share. The interrelationships of share with Gan and other Zang are discussed on page 189. Rules the tendons. The Chinese term jin is often translated as tendons, but may refer to the tendons, ligaments, and muscles of Western medicine. Hence, the word tendons is given a capital letter in this book when referring to the Chinese concept, since it does not exactly correspond to the tendons of Western terminology. The tendons associated with the Gan function refer more to the contractile aspect of muscle function, whereas the muscles associated with P function refer more to their bulk and strength. If Gan Qi is deficient, the tendons are not properly moistened and nourished by Qi, and their contraction will be impaired and inharmonious, resulting in stiffness, spasms, tremors, and numbness. The interrelations of muscles and tendons are further discussed on page 173-4. Opens into the eyes, manifest in the nails. All the Zangfu are involved in the proper function of the eyes, and the various Zangfu disharmonies manifest in the eyes. Traditionally, Gan Qi is associated with the ability of the eyes to distinguish the 5 colors, and Gan Qi is associated with good vision. Various Gan disharmony patterns affect the eyes. Deficient Gan Qi causes to blurred vision and dry eyes. Blazing Gan fire causes to eyes red, sore, or irritated. Stirring of Gan wind causes to tremor of eyeball. The interrelationships of eyes with the various Zangfu is discussed further on page 176. If Gan stores and regulates Qi properly, the nails are pink and well formed. Gan disharmonies may result in pale, thin, brittle, rigid nails. Patterns of disharmony: depression of Gan Qi, deficient Gan Qi, hyperactive Gan Yuan, blazing Gan fire, stirring of Gan wind, damp heat in Gan and Dan, stagnation of cold in Gan Jinluo. The foundations of Gan pathology are: 1. Depression of free-flowing of Gan Qi, resulting in stagnation of Qi and Qi, and in disharmony of digestion, menstruation, emotions, and behavior. 2. Deficient and irregularity of Gan Qi, resulting in problems of tendons, nails, eyes, and menstruation. 3. Tendency of Gan to deficiency of Yin, to dryness and heat, to hyperactive Yang and blazing fire. 4. Stirring of Gan wind due to deficient Gan Qi, hyperactive Gan Yang and blazing Gan fire, or to severe fever. 5. The combination of internal or external damp and heat with the tendency of Gan to stagnation is associated with the accumulation of damp heat in Gan and Dan. 6. The combination of stagnation due to depression of free-flowing of Qi with stagnation of cold result in stagnation due to cold in Gan Jinluo. Origins. Figure 9.1 outlines the main origins and the interrelationships of Gan patterns of disharmony. The origins of each individual pattern of disharmony are discussed below in the appropriate section. General Gan signs. Signs of Gan disharmony derive from disharmony of 1. Gan functions, for example, free-flowing of Qi as it affects digestion, emotion and menstruation, and storage and regulation of Qi. 2. Tissues and orifices ruled by Gan, that is tendons, nails, and eyes. 3. Distribution and interconnections of Gan Jinluo. For example, Gan Jinluo passes through and connects with the head, eyes, hypochondriac, and genital regions. Hence, signs common to all Gan patterns of disharmony tend to include digestive disorders, emotional disharmonies, menstrual problems, affections of the tendons, eyes and head, and distension of the hypochondrium. Depression of Gan Qi. Origins. This is one of the commonest patterns in clinical practice. Its usual origins is in emotion disharmony, especially depression, frustration, irritability, and anger. The relationship between emotional disharmony and depression of Gan Qi is not so much one of cause and effect, but of mutual interaction. Signs. The key signs in this pattern are depression, sensation of distension, and tenderness of hypochondrium, chest and breast, poor digestion. Jingluo signs. Sensation of distension in hypochondrium in chest, signing, sensation of plum seed qi in throat, lumps along the jingluo. Emotional signs. Depressions, frustration, irritation, and anger. Digestion signs. Poor appetite, poor digestion, nausea, belching, sore regurgitation and vomiting, epigastric pain, abdominal distension and pain, borborygons, loose stools. Bile signs. Jaundice, bitter taste, vomiting yellow fluid. Gynecological signs. Premenstrual signs, for example, distension and soreness of lower abdomen and breast, irritability, etc. Irregular menstruation, amenorrhea or scanty menstruation, infertility, dysmenorrhea. Pulse and tongue signs. Pulse wily, tongue normal or purplish. Pathology. Jingluo and general. Impairment of free flowing of qi leads to stagnation and accumulation of qi, and hence to the sensation of distension and pain along the course of the channel. Characteristically, the pain is not severe. It may move in location, and it may come and go, especially with increase and reduction of emotional disturbance. If, however, stagnation of qi progresses to stagnation share, pain is more severe, often stopping, and does not change location or come and go. The pulse changes from wiry to wiry and choppy, and to tongue changes from normal to purplish, perhaps with purple spots. Location of signs depends on the area affected by stagnation. For example, if it is stagnation of qi, there may be distension and soreness in the breast, hypochondrium and abdomen. There may be a stuffy feeling in the chest, accompanied by signing. The depression of Gan Qi may invade the throat, combining with the phlegm and cause the flowing body or plum seed qi sensation in the throat, which characteristically comes and goes with depression. Qi and xue may stagnate at various locations along the course of the channel, forming lumps. Emotions. Physical, emotional, and mental vitality seem stagnant and depressed, and the individual feels low and dispirited. Basic moods of depression may be punctuated by outbursts of anger and irritability. This pattern emphasizes the importance of emotional disturbance in originating disease. Here, depression may precipitate digestive and gynecological disharmonies, and also pain and discomfort along the course of Gan Jingluo. Digestion. There is a very close relationship between Gan and Dan and Pi and Wei. If depression of Gan Qi invades P and Wei, there may be a mixture of P and Wei signs. If Gan invades Wei predominantly, Qi tends to ascend, causing nausea, belching, sore regurgitation, vomiting, and epigastric pain. If Gan invades predominantly P, Qi tends to descend, causing borboric mass, loose stools, and abdominal pain. Bile. If depression of Gan Qi impairs bile secretion, in addition to general signs of digestive disharmony, for example, loss of appetite and nausea, and distension of hypochondrium, there may be jaundice, bitter taste, and vomiting of yellow fluid. Gynecology. In menstruation, Gan communicate with the uterus via Renmai and Chongmai. Gan, Renmai, and Chongmai are all concerned with the unobstructed movement of Qi and Xue in menstruation. If there is depression of Gan Qi, there will be an interrupted and uneven flow of Qi and hence of Xue during menstruation, resulting in irregular and scanty menstruation. There may be sensations of depression and irritability, and of distension and tenderness of abdomen and breast, which characteristically builds up prior to menstruation and declines once it commences. If the stagnation includes stagnation of Xue, then dysmenorrhea will characteristically include severe stabbing pain, which may be eased by the passing of clots of blood. The interrelationships of Gan and other Zang in gynecological disorders are discussed on page 205. This common pattern of disharmony may exist by itself, may be a precursor for other Gan disharmonies, may coexist with other Gan disharmonies, may be a precursor of disharmonies of other Zang, for example, of P and Wei, and may be combined with a variety of syndromes of other Zang. Treatment. The principle of treatment is to invigorate Gan Qi and to disperse stagnation, using even or the reducing method. Reducing method is used more in cases of severe pain, as in stagnant Xue. Even method is used more in milder cases with milder pain, as in stagnant Qi. The points used depends on the combination of disharmonies manifested by the individual, as in the following three examples. Premenstrual tension and breast lumps. Taichung, liver 3, invigorates Gan and regulates circulation of Qi and Xue, relieves pain. Qi-Man, liver 14, as above, especially for pain in hypochondriac and breast region, and as combination with Taichung. Rugen, stomach 18, specific for breast problems. Dysmenorrhea due to stagnant Xue. Taichung, liver 3, to disperse stagnation of Qi and Xue and hence to relieve pain. DG, spleen 8, accumulation point of P, regulates Xue and uterus, especially for dysmenorrhea in combination with Hegu. Hegu, liver 4, large intestine 4, clears channels and suppress pain. Indigestion and gastric pain. Taichung, liver 3, regulates Gan to dispel invasion of P and Wei by Gan Qi. Changmen, liver 13, regulates Gan Qi, regulates circulation of Qi and Xue, aids transformation and transportation by P. Alarm point of P. Gongsang, Spleen 4 regulates pee and whey, relieves pain. Common disease patterns. Depression of Gan Qi may be a component of various diseases. Depression, indigestion, cholecystitis, mastitis, breast lumps, premenstrual tension, amenorrhea, dysmenorrhea, etc.